Take the opportunity to interview or introduce our webinar participants. My name is Paul Atkinson. I'm the founder of IQMax. I'm going to be acting as your moderator and speaking. I have next up, which is John Lewis. John is our licensed practical nurse, one of our senior clinical solutions specialists. We are happy to have him on board and giving our presentation today. We also have Heath Long. Heath is our product manager, and he will be doing a live demo today. I'd like to start off by talking about a little bit about our mission statement in IQMax. We have been around for almost 14 years, totally focused on healthcare and really delivering these on-demand mobile solutions and application that's built around our patient-centric platform. And we have multiple different plug-in apps. And today we're going to be focusing on communication. Those plug-in apps we have are multiple. We have dictation, we have charge capture, we have a rounding app, a patient list app, and census list app. And then today we're going to be, again, I said, focusing on communications. So when we look at the value proposition, we want to talk about mobilizing healthcare. And although we are focused on that mobile device, which would be the iOS, Windows Mobile, Android, I want to point out some specifics about our platform and how we design this. So when we talk mobility, we do talk about any internet appliance. One of the unique values about our company is we've built a platform so now you can use, whether it's an iPhone, a mini tablet, a desktop device, a laptop, you are able to use any internet appliance. And being able to connect to caregivers. And one of the, again, the strong value propositions we have is our integration engine that we built ground up. So we've interfaced and integrated to over 65 back-end systems. It ranges from Siemens, Cerner, Epic, McKesson, Allscripts, NextGen, just to name a few. And that really helps us integrate clinical information as well as normal information, such as information around Active Directory, providing you a list in a corporate directory to access at any time. And what that does is it streamlines the efficiency and drives better clinical outcomes. It also helps us reduce healthcare costs by delivering cost-effective applications. And of course, as your patients will see and also your caregivers and providers will see, it increases satisfaction. When we look at the current state of clinical workflow, we see this as kind of a spiral of technology and process and caregivers all around the patient. And this actually provides some opportunity. It also provides a little bit of confusion. As we've seen in some of our statistics and industry stats, caregivers are spending 12% of their time in unexpected incidents, taking time away from the bedside and the patient. And nurses are spending 21% of their time. That's a 1.5 hours per 10-hour shift on communication activities related to coordinating care. And our med-surg disruptions and workarounds occur on average every 4.5 minutes. So this has obviously a huge impact around clinical workflow. And this clinical workflow could be focused a lot on patient care and patient safety. And as we've seen from the Joint Commissions, 80% of serious medical record or medical errors are caused by communication failures. And 50% of those communication breakdowns occur during handoffs. And a lot of those are focused around medication. Up to 95% of those medication errors can be prevented by better communication tools. So today we're going to be talking about how we can improve the enterprise communication and deficiencies. And as we've started to look at this, we have seen there are some unique aspects of this within the healthcare vertical. First, we've noticed that there's really no standardized or centralized communication solution method. It varies from hospital to hospital, from floor to floor, from role to role, from even person to person. And also what we've seen is it varies on who the person is contacting. Maybe calling person X, they text. Maybe reaching out to person B, they call. Maybe sending an email. So there's multiple different ways of communicating down to the sticky note. And this is just really an inefficient way to have and really not having any two-way communications. We've also noticed that most of the communications have no clinical data. There are no integrated clinical information, which is a significant issue, because one of the things you want to do is communicate more information precisely to the appropriate party or parties so that you can get on with your proper care. And then one of the biggest things we've also seen is IT is just at their wits' end, because they have to support all these numerous different platforms, numerous different communication solutions. And then with the advent of the HIPAA compliancy and security access, it becomes a major concern for them. So one of the things we want to do in our next slide is we're going to bring in John Lewis. John, as I introduced earlier, is our licensed practical nurse, and he is going to go through some of these clinical problems, communications problems, starting with the first one, which is unsecure messaging. So John, I'll let you take it away.
Okay, thank you, Paul. We have identified 3 specific communication problems that we have observed in hospital networks across the United States, and we're going to present those now. Now, the first problem that has most of the hospitals going back to the HIPAA compliances is unsecured messaging. Up in some of our hospitals that we are communicating with and working with, they have admitted to the fact that they think that up to 40 to 50% of their staff at some time has used their own personal mobile device to send information and images back and forth between the care team. Now, it is an efficient way of doing things, probably compared to the method that they have at their hospital, but the problem that comes with that is that these devices are not safeguarded by the hospital network. So the example that we have right in front of you right now, we're going to go through one of these situations where the doctor has made multiple attempts to contact the floor nurse through the hospital phone directory. They have finally made contact, and what's happened, the doctor has reviewed a patient. We're going to call him Alex Holmes and use him through this demonstration. He's a 60-year-old male who has been admitted to the hospital because of an MI. After reviewing his records remotely through the EMR, he's going to ask the nurse and place an order for an EKG to be done. So when he contacts the nurse, he wants to ask her, after the EKG is done, could you simply take a picture of the strip, attach it to a text message on your phone, and send that to me so that I can review that. The nurse says, no problem, I can do that for you. She enters the doctor's number into her contact list and sends that picture through SMS, through an unsecured SMS system to the doctor. The doctor reviews that strip at this time, and he decides that he's got enough information to make a decision, but he would like to, at the same time, get a second opinion. So as we see in this diagram, he contacts the hospital operator to find out who is the cardiologist on call. He gets the cell phone number of that cardiologist, calls him, and tells him the situation that he's in. I would like to get a second opinion on one of my patients. The cardiologist obviously will say, sure, that's no problem at all. That is his job. So the doctor gets the cardiologist's cell phone number from him and forwards that image and text information that he's gotten so far to the cardiologist. Now the cardiologist goes ahead, reviews that, and sends his impressions back to the doctor or calls him. And now that information has made a round loop that is now going to give the doctor the ability to go ahead and treat or set up protocols to further advance the care plan on this patient. Once again, though, we have to reemphasize that that information, even though efficient, is now lying as stored information on all 3 devices, and HIPAA compliance is not being met. So the problem that we're seeing in this is that HIPAA security violations can result in huge monetary penalties. The average cost of breach, which is the information that's been passed around when detected, it's averaging about $2.4 million a year. The most common compliance issue is the lack of administration safeguards of the patient's health information. And when you step outside of the network, there is no way that the hospital possibly could set up those safeguards that are necessary to make sure that information does stay compliant and it does stay privy only to the caregivers. The common cause for this breach is theft and loss of computing device. Now, the theft of this phone is not necessarily saying that the phone was taken because of this particular information, but if the phone is lost or the phone is stolen, that information does go with the phone. And if it is recognized by somebody who decides to display that, once again, we have a breach of information that the hospital will be ultimately held responsible for. So the solution that we want to introduce you to using IQ Communicate is secure and efficient message delivery. We can set up a secure delivery system inside the safeguards of the hospital's network so that they can keep control, that allows the doctor, the care team, the specialists, all involved in care to bidirectionally communicate each other with secure communication flow. We can also integrate real-time patient information. But the biggest thing that's answering to the HIPAA compliance is that all of these caregivers' devices, no information lies on the phone, as we showed an example before. What we are doing is only giving you a view of the information that you can use and mobilize to any person you want, but all the information resides within a server inside the hospital firewall, so it's completely protected. It gives instant access to care team members and ancillary services so that if I need to call somebody who is an RT, I do not need to know who the person is. We've arranged it so that all you need to do is call that department, pick that department on your phone, and it'll automatically, through IQ Communicate, track to the proper person in order to get things done. So what we're saying from this standpoint, we are delivering right information at the right time to the right caregivers. Now, the next problem that we have identified is one that we're calling task management, and this is throughout the hospital network. And I know a lot of you have been around in the health field long enough to remember paper charting. And what this is addressing to is right now one of the biggest problems that we see with EMR goes back to actually CPOE, the ability of a doctor to, from a off-site, place orders or clinical protocols for a nurse or a staff member. Now, when we were doing paper, the only two ways that a doctor could possibly get that information to you is that either he was on the floor and he discussed it with you, or at least as a nurse, we were all looking over the side to see when he was done, and we'd automatically go over and review the chart, or at least we knew that chart needs to be reviewed. So the communication gap has not been delayed. I know there's things there for me. The other way that they're able to do it is that they would call in, and we all have taken call-in orders or fax orders, which means that that information is now being directly delivered to me as the primary caregiver on the floor, or delivered to me through a fax, and I'm made aware of those changes of status or orders or protocols so that I can act upon them in a timely fashion. Now, the problem that we have now with CPOE is that when a doctor can remotely put in orders, protocols, treatments, without having to contact the nurse because he's doing it electronically, the EMR does not tell the nurse that he or she have new orders. And as you know, being on the floor, we have multiple jobs we're already doing. We're already caring for maybe 6 to 8 other patients, and we're trying to keep up with their medication, their treatment, their documentation. So we have to figure times into this in order for us to go and update ourselves on new things that can happen to this patient. That doesn't, unfortunately, that means that at times that we may not, under certain circumstances, see those updates for an hour to an hour and a half, which could cause delay in patient care plan. In this scenario, we're talking about the doctor was planning to, after putting in these orders, to come in and talk to Alex about these new orders and protocols, hoping to expedite his discharge. If the results came in, we might be able to discharge Alex by tomorrow morning. Unfortunately, since those results won't be available to him because I have only discovered these new orders a couple hours later, the discharge has been placed off from that time period to maybe even the next day, even though the results, if the results come in properly. So the problem that we're seeing with this on delay is that first one is the compromised compliance with hospital protocols and treatment. Now, we're saying that that compromise is not one of negligence, but it's one of miscommunication, that there's nothing to give me an idea that these orders have been put in. Therefore, I may be doing this at a later point than when the doctor wanted. Duplicated tasks and inefficient staff time management. Every time that this occurs, I am now working new things into my old work stream. And at that point, it changes course, because I'm now having to deal with new things where I thought that I have had where other problems or other tasks for other patients sits in that particular incident. And the inconsistent delivery of needed care. What we're referring to that is the fact that if I review, there will be ones that I catch on time, but there will also be ones that will be late in their delivery and me doing this for that patient. The Journal of Healthcare Management has stated that over $12 billion a year has been spent on the communication efficiencies, and 53% of that is directly involved with delay of stay. Now, the benefits that we were talking about, the solution using, once again, the same program, IQ Communicate, is that when a doctor is offsite, as you see on the right-hand side, when he puts an order into the EMR for a stat order or for an order change, we can then immediately after that order is in recognize that order and shoot to the phone a task based off of that order, or a notification based off that order that there has been changes to one of your patients or patients. And those tasks come to you on your phone in a task list that is patient-centric. It's not a long list. It's based on each one of those patients. But it comes to you in a timely fashion so that you are able to not having to stop, drop, and change things around, but you're knowing it early enough that we're able to then ease those things into our workflow so that the time that is being consumed to change management is minimal. Now, the other benefits is that we can enhance real-time awareness of those order entries that we talked about. We can expedite stat requests by connecting caregivers on one platform so that if a stat order comes in, you're automatically connected with the physician who put that order in for you. So that if there's things that you need for clarification, it's simply a one button push or push back to that doctor to talk to him directly. You're not looking up anything. Inside IQ Communicate, we can coordinate this kind of communication and delivery. And we can also consolidate and timely access to treatment instructions. If protocols come across, which is a big one for us, not only can we be aware of that protocol, but with that, the steps that are needed to be taken, we can also deliver that to the phone so that you can go ahead and start the care, start the protocol, so that the only reason that you're going back to the EMR is to sign off that I have completed this task or this protocol at this time. Now, the next slide that we're going to talk about that has been defined is referring to the event notification. Is referring to event notification. The event notification that we want to refer to at this point the event notification that we're going to use is
welcome to GoToWebinar, web events made easy.
The events that we're talking about now.
John, are you having technical difficulties? Did you drop off?
Yes, I did.
Okay.
Hold on.
Heath, do you want to pick up comms problem number 3 for him?
Yeah, certainly, Paul. So basically what we're talking about here is...
Heath, I'm back online. I can do it for you. That's no problem. I've got it.
Okay. Go ahead, John.
All right. I'm sorry, folks. I'm sorry for the delay of the technical difficulties. But event notification, and this is probably one that is more crucial than anything that we've been talking about. This is talking about something that directly affects patient care. The scenario that we're going to talk about is when a critical lab or a particular test comes back outside of the range of the normal range that is set by the laboratory. So in this particular case, we're going to look at where a doctor places new orders, and we're going to go back again to our patient, Alex Holmes. We're going to look at a blood serum result, and they had taken a troponin testing, and it came back critical out of range. So the situation from there is that the lab, traditionally in the traditional setup, the lab will then contact the nurse, and it may take several different times in order to get the nurse who's in charge of Alex's care. They will read that lab to the nurse. The nurse then will verify and read it back to the lab to make sure that they got the right patient, the right testing, the right result, the range that it needs to be in, and the result that came back from that testing. After that has been established, the nurse then is going to call the hospital operator to either whatever way it's set up for connection, either a page or calling the office service to connect with the doctor that needs to know the results of that lab and be able to start doing care in order to change, to reverse the findings that they have at this time to make sure that this is no longer a critical situation. So in that whole scenario going around, as you can tell, there are a lot of handoffs between people going back and forth. Because once the doctor calls back in, the nurse then reads that lab again to the doctor to make him aware of what's going on. The doctor is usually required to talk back to the nurse to say, okay, we're on the same page. I do understand that this is Alex's results. And then they move on to see what they're going to do to correct or the treatment that they want to do from this standpoint. Now, because of this certain delays and waiting for connections, a lot of hospitals have initiated the policy that on certain lab criteria, or if they exceed a certain amount of time for that turnaround from test to doctor, that if it exceeds, most of them are at 60 minutes, that I have to go in and redraw the lab. The critical value that we've been trying to work upon or first notified on is no longer valid. So the problem that we see with this is that patient experience of care is compromised. We've all been in the situation, not necessarily just for labs, but things that we've had to repeat for the patient, and the patient wants to know, why are we doing this again? You were just here 2 hours ago. So that establishes the patient is now concerned about what's going around. There's also a wastage of resources via duplicate testing. There's a lot of times that what we were talking about before is that when things come in a delay and I'm first doing it, I work around that. But if I've got to, especially because of the fact that communications drop, that I have to duplicate anything, that is time lost that I cannot get back. I shouldn't have to be doing this, so therefore that's time that I must just basically waste away at that point, along with the resources to recollect or reestablish again. And if this happens a duplicate amount of times for any staff member, this comes under staff dissatisfaction with that particular process, not necessarily with the means and what's going on, but the process of communication is not working from that standpoint. So the solution that we was, once again, using the IQ Max Communicate, is that we are able to set up a mobile patient-centric care coordination. And as you see on the right side, what we're now looking at is that when that lab reports, or the system reports, that troponin, which is the lab that we gathered for Alice, is in a critical stage, a system-generated notification on that alert will go directly to the nurse, delivering the information, delivering the patient's information from that standpoint, saying that a critical value has been reported. She will then, or he will then, put acknowledgement that they received that, which will go back into the IQ system showing that, yes, that lab was reported to them, which is helping on that first communication point about them calling and trying to make the nurse aware. The nurse then will have the ability to do a push-to-talk button back into the laboratory. And instead of them repeating the lab back to her and her back to them, they both have the lab. They're just confirming that it's the same information. From that standpoint, instead of going through the switchboard, she can then simply just have a text message that has the patient's chart attached to it, and later we'll show you how that can be done. But they can send a patient message to the doctor and simply put in labs for this patient came back out of range, and tell the specific lab that he needs to be looking for, which is troponin. The doctor then goes into patients, opens up the view to go into the lab section of the charting that's been sent to him and review that lab, and then call back to that nurse, letting her know at that time with a direct push to call that what we're going to do, since the troponins are high, we're going to place him on a beta blocker, and we're going to use low pressure for this example. And I'd like for you to administer the first tablet ASAP. So she goes and gets that medication out of the Pyxis. At the same time, he's putting orders in for the pharmacy for both that immediate or that stat delivery along with the information on how to continue that care. And all of this that we're talking about, instead of having it exceed the 60 minutes, this all can be done within 10 minutes. So it expedites that care. It gives the critical lab delivery to the right person at the right time. Caregivers are updated and notified in real time based on patient care, and it improves caregivers' response at the point of care. So at this point, I'd like to turn it back to Paul, and thank you very much for your time.
Thanks, John. I appreciate that. Sorry about the technical difficulties, but good job in recovering. At this time, we're going to do actually a live demo. This will be done by Heath Long. Heath was former CIO of a large multi-specialty clinic, and he has joined IQMax from a product management position, and he is going to demonstrate this live. He is using actually an iPad connected wirelessly. So this is a live demo, and at this time I will turn this over to Heath Long. Heath?
Okay, thank you, Paul. Thank you as well to all of our attendees today for joining us. So as Paul mentioned, I'm going to walk through a few scenarios, mainly addressing the problems that John has brought to our attention. And I'm going to do that inside of IQ Communicate. And hopefully you will be able to see the benefits of using a unique solution such as IQ Communicate to help facilitate your clinical workflows and improve your patient's satisfaction. So the first scenario that we're going to walk through, and drawing back on the problems that John brought up, were those related to unsecure messaging or insecure messaging. So the problem, the example that John gave us in that was that an order was placed for an EKG on a particular patient, and a request was made from the ordering provider to send an image of the EKG strip back to that provider using SMS. So we're going to show you how to do that inside of a secure application. In our case, IQ Communicate. So I'm logged in to IQ Communicate here, and we're logged in as a care team member. In this case, we're going to be playing the role of a nurse. And you can see that I have several items in the inbox area of the application, but I'm going to go look at the messages, the text message first. So I'll tap on messages, and there you can see that the first message in the list, as I tap on that, is from Dr. Smith. And this is a duplication of that problem that John used in the first scenario. So this is a request to text message the photo of this particular patient's EKG strip. So something about this particular conversation that we've mentioned is that IQ Communicate has the ability to interlace and attach patient-centric and patient-specific clinical information to a text message conversation, which limits the abilities or reduces the chances and risks of typographical errors and things of that nature. So there's always, you're always certain that you're communicating on this specific patient. And the drop down at the bottom of the message screen gives access to the patient's clinical information directly from this message. So to facilitate that, again, logged in as the role of our floor nurse in this situation, I'm going to tap on, I have an image of the EKG in front of me. I'm just basically going to capture an image of that screen and send that securely through the application. So to do that, I'm going to tap on the paperclip attachment icon in the lower left-hand side of the screen, and I'm going to select Take Photo. And as I do that, on my second monitor, I have this image of the EKG strip. I'm just going to capture that. I'm going to select Use. And then I can annotate that image as well. I'm going to send that back to Dr. Smith. Just say that it's attached. And then we're going to send that away. So as we do that, it adds that thumbnail image to the message. And so at this point, that's been sent to Dr. Smith, and I'm actually going to now log in to the application as Dr. Smith and show you the other side of that communication. Okay, so here we can see that Dr. Smith has received the message. I can go in and view it. It's from our it's from our care team user, and I can actually then, as Dr. Smith, I can tap on that image to open it. I can view the image inside of my device, close that. I can also go in and tap Go at the bottom of the screen next to the patient's name to go in and view the clinical information. Here we can see some basic demographic information, again confirming this is the right patient. From this drop-down list, I can access various clinical components. Let's say that I want to go in and view the labs on this particular patient. Here I can go in and review those labs, then scroll down and tap Return to Conversation and go back and formulate a response. In this case, in that scenario, the next step was that the provider wanted to share this information with a cardiologist and contact that person. So I can actually, rather than in that scenario where we were calling the hospital operator and exchanging cell phone numbers, etc., I can actually just forward this actual image to that provider. So we don't know who that on-call cardiologist is, but I can tap on Forward, tap the gray button for contacts in the to line, and I can communicate as part of the enterprise directory or contact directory. We also have roles. This is role-based, directory-based messaging. So I don't know the necessary name of the covering cardiologist at this time, but we have a role for that, and based on the schedule for the cardiologist, etc., those resources, etc., I can then go in and select that cardiology on-call role, select that, and when I return to my screen, it's going to actually resolve that to the appropriate care team member who is filling that particular role at this time. In this case, it's Dr. Jones. So again, I can go in here, forward that message over to Dr. Jones. I'll just ask for I need an opinion on this particular patient. And obviously the patient information is attached. I can send that message away, and it'll return me to the previous screen that I was on. Okay, so that facilitates the first problem, which was the unsecure messaging. So now that brings me to our second problem, which was task management or order awareness. So I'm going to log back into the application as our care team user, and we're going to specifically look at task management order awareness. So part of that scenario was that the order was sent to the respective care team member to perform that 12-lead EKG. So the way that IQ Communicate has different interface points, obviously. We can either accept that order as it was entered into the EMR and route it, or the provider or ordering person can actually go in and facilitate that task directly from IQ Communicate. So I'm going to go into tasks for my care team user, and we'll notice that I have 2 task requests. We can see that they have varying criticalities. I'm going to look at the second task request, which is the actual cardiac triple marker 12-lead EKG. And this is basically the order that's received. It's routed to the appropriate person based on their relationship to the patient, as well as their scheduling and location in the facility. And you can also see that the task is, again, contextually linked with the patient. So I have the option now, as receiving that task or receiving that order, to accept or reject it. If I accept that, it's going to move that to a pending task list or an in-process task list for me, where I can continue to work the task. And it also sends a notification or a status on the the task back to the originator. So in this case, this came from the EMR via an interface when the doctor ordered it through the CPOE measure. So we can close that, and I'll return back to the inbox. So the last problem and the last scenario that we're going to walk through was the event notification. So in this case, again, we're logged in as our care team user, our nurse, and we've received an alert. So I can go into alerts, and we have a critical lab value here. I can actually tap on that to view it, and there we can see that that would be the cardiac enzyme. We're giving the reference range, etc., and what the actual result value was here. Again, contextually linked, so I can go in through my workflow, verify the result, and then via the drop-down, I have a contact that I can go into for the lab and directly call or send a message to the lab based on my protocol to acknowledge that particular alert. So at this point, I could then send a message as well to the attending physician, but in our scenario, the attending physician also received that alert. I can go ahead and acknowledge that alert as well while I'm in here. So that sends a message back that I have acknowledged that alert as well. The attending physician has already seen that, and so a task has been created and routed to me as the nurse for a medication order change. And so this is a critical, again, it's on Alex Holmes. I can tap on the individual task here to view that. So here we see that the medication change is going to be based off of those lab results that we received. We're going to switch over to a Lopressor. You're seeing the dosage, the route, the frequency information, etc. All of that inside of that task. Again, I can accept that task, go in, and then in process tasks, when I've then administered the particular drug in this case, I can complete the task, which sends the notification back to the ordering physician, in this case Dr. Smith, that that task has been completed. Okay, and then finally, as part of the workflow that IQ Communicate facilitates, I then can go out to the actual patient, and by tapping on the blue icon next to Alex Holmes' name on the patient list, that brings me to a feature of IQ Communicate called the patient wall. And so the patient wall is basically, it allows all associated care team members for a specific patient encounter to post and view information about that patient. So as part of my workflow, I can then go in and just give a general status update so that other members of my nursing team, as well as the care team in general, can see just that general update on the patient. So I'm just going to say that the medication order has been administered and that the patient is now resting comfortably. Okay, so when I tap send on that, that will post that message to the wall, and then as I said, other care team members will have the ability to go in and view and post their own messages to that. So at that point, that concludes the demonstration, the live demo portion of this, and I will turn the webinar back over to Paul.
Thank you, Heath. I appreciate that. As you notice, your screen will be changing momentarily. We've gone to the question and answer session of this webinar. There's a lot of questions coming in already and stacked up. You can notice that there's an area where you can submit those questions. We will not get to all those questions. Some of them are very specific to your particular case and your particular hospital or situation. I would certainly want to answer those. You can reach out to us momentarily. I'll give you some coordinates to reach out to us. We can do a special webinar specific for your back end, for your institution, and answer those specific questions you have. We're going to bring in Chris Dambakaris, who's going to moderate us through some questions that have stacked up. So I'll let Chris go for the first question.
Sure, Paul. First question we have out there is, how does your software stay in sync with patient data, doctor, and nurse contact information as well as schedules? So Heath, I think that question is more directed to you.
Okay, sure. So there are a lot of methods that we have. We've sort of talked about integration to some level, but IQ Communicate, the platform itself, has the ability to integrate with various nurse call systems, resource scheduling systems, Active Directory as well. So we can actually then take that information through real-time interface feeds, populate the contact list, the enterprise directory list, and then so as your resources are scheduled in those systems, we can dynamically display that in real time so that we always know who the appropriate resource is at the right time. Also, for situations where your facilities may not have specifically defined scheduling systems, IQ Communicate also has an integrated built-in scheduling model as well. So you can take users that have been either entered into the system or brought in through the directory integration and then assign those resources and users to roles and also associate them with a particular schedule.
Okay, Heath, looks like we have another one for you. Does your solution work outside the hospital network, and if so, how?
Yes, absolutely. So we have a couple different deployment models. This solution is available in a hosted software as a service model, or as John mentioned earlier, it can be deployed securely within the walls of the organization. In the first scenario, where it's a SaaS solution, a hosted solution that's hosted in either the IQ Max data center or your data center, in this case, it would be ours. And so that all of the information is accessed over HTTPS securely in that model to our data center. If the solution is deployed in premise, and if your policies and procedures permit VPN connectivity, or if you expose the URL or the link to the application through the firewall, that can be done as well. The application runs over Wi-Fi as well as also runs on the cellular data networks as well. So any internet-connected mobile appliance as well as any internet-connected desktop computer can access the application.
Okay, here's one more. What if the provider or caregiver does not have a smartphone device?
So, and again, I'll take that one. So in the event that a provider doesn't have access to a device or a smartphone device or just chooses not to carry one, I kind of alluded to this in the previous answer, the application can be accessed via a desktop web browser. So you have an HTTPS link session that you can join via a browser. And then the specific events that you receive, the application functions just the same as what we saw in the demonstration. We also have the ability to send out of application notifications of events as well. So for users who are logged out of the application but maybe accessing through a desktop web browser, we can send those notifications to an email link, which you'd receive in your email inbox. Click on the secure link to log into the application and view the event.
Okay, Heath, we have any priorities, high, medium, or low, on messages, alerts, and such?
Yes, IQ Communicate has three criticalities. We have a normal, which is just a regular, low priority message. We have a warning, which is an escalated message criticality, and then we have a critical that we recognize. So you can assign, you can either assign those criticality levels to a particular message or event, or if we receive those through an interface, such as from an alerting system, and it comes across with that criticality, we automatically route the message or event based on the criticality level to the right person as well.
Great. Paul, I'm going to turn it back to you. It looks like we have a bunch of other questions that are very specific that, as you mentioned, we should probably get back to the individual folks who asked those questions.
Perfect. Thank you, Chris. Thank you, Heath. So for those of you who would like to contact us, you can reach out to us at sales@iqmax.com. That's sales@iqmax.com. You can also visit us on the website at iqmax.com. You can call us. You can connect to us via our Twitter or Facebook page. You can see that contact information as well. I know you'll have some specific questions around your needs. We have sales specialists and solution specialists that are teed up to be able to do a webinar and or a site visit. We can show you this running. We can allow your team members to play with the application, and we are certainly available to do a pilot and install, of course. So please feel free to reach out to us and contact us. At this time, I appreciate your time today. This will conclude our webinar series for Advanced Secure Messaging. We look forward to chatting with you in the near future. Thank you very much.